What can we learn from the US about how to reopen universities safely and how to manage other things like social distancing? Gavin Yamey is a professor of global health at Duke University in Durham, North Carolina. Gavin, good evening.
Good morning, good evening. Thank you for having me on.
Morning with you, Gavin. Evening with me. You recently wrote an article for the BMJ, didn't you, on what the UK can learn from what you described as the United States debacle on universities. So what can we learn?
Yes, that's right. It's been an absolute catastrophe here. Actually, just last week, there were more than 36,000 new cases of COVID-19 on campuses nationwide. An absolute debacle, as you said. Now, I think that we, of course, have more COVID infection here. So that is an important lesson. I think that where rates of COVID-19 community transmission are high, reopening universities is risky. I think the places that have done the best in America are places that did bring viral transmission under control. So in the UK, if there are areas that have brought down viral transmission, they're likely to do better. We've also learned the importance of testing. Testing. This virus moves at the speed of light. And the universities that have done the best here, they tested every student when they came back to campus, and they've been doing what's called surveillance testing. They've been testing many, or in some cases all students, a couple of times a week. That's really the only way to prevent outbreaks.
All students multiple times a week? That must be a logistical nightmare.
It is. It really is a logistical challenge. But what I would say is you have a duty, if you are a university leader, if you're going to open your campus up, to be safe, to prevent outbreaks. And we know what it takes. You need to have low levels of transmission in your community. You need regular testing. It's good to do a quarantine. So many universities had 2 weeks of quarantining of students before they started classes. You certainly have to have a very robust testing strategy in place. You have no right to reopen, in my opinion, if you don't have a robust testing strategy. You've got to stop blaming students when things go wrong. It's been so dispiriting, so disheartening when outbreaks have happened here in campuses in America, when university leaders have shamed students for socializing or having parties. Shaming is an ineffective public health strategy. It never works. In fact, what you need to do is offer so-called harm reduction approaches, safer ways to socialize. So have outdoor events. We know being outdoors.
So what happens? So in this model that you're talking about in America, where, okay, so the universities have opened, they're testing a couple of times a week, they test students, one of the students in the class it tests positive. Now, the way students work is they mix across lots of different classes in any given day. So who's quarantining? If one student is identified as positive, how many quarantine? Is it the whole year or what happens?
You've hit the nail on the head. So that's where you have to have a really great contact tracing system in place. So if a student tests positive, you have to identify any student that's been exposed. Now, of course, one way to keep your levels of exposure low is to have most classes online. So even the universities that have brought students back, many of those classes are online. Some are in person. Hopefully, those classes are small classes, so you can keep a track of the numbers. Now, scientists are saying that an exposure is if you've been with someone for at least 15 minutes. I mean, it's not a hard and fast rule. So if you have been in a classroom with anyone else, then those people would get tested, and whilst waiting, you would also be quarantined. So, of course, all of this suggests public health preparedness. It suggests you have to have a really robust plan in place. It was very clear in America. I mean, I wrote an article with a colleague of mine, Katie Mack, at NC State University 2 months ago, saying, look, we don't think many universities are ready. They don't have their protocols in place, right? They are not seeing low levels of community transmission. They're not planning robust testing. They don't have contact tracing in place. They're not accepting that students are going to gather. They're not planning any sort of public dashboards to kind of say, look, the UK is in a different position to the US. The risks are somewhat lower. but they are still there. And don't make the same mistake. Don't go down the same route that we did here in the United States, because if not, if you do the same as what we did, you will have outbreaks, and outbreaks matter for a whole variety of reasons. Of course, being sick you want to avoid students being sick. About a tenth are going to go on to have long-term symptoms. Those can be quite debilitating, so-called long COVID. But perhaps even more worrying is that infected students will infect others, right? They'll infect teachers, lecturers, and they'll infect the maintenance workers, the catering staff, the bus drivers, the cleaners. And here in the United States, over 40% of service and maintenance workers are people of color, and we know that they are already at higher risk of dying from COVID-19. So this is a disaster waiting to happen in the UK if the right steps are not taken to avoid outbreaks.
Gavin, let's bring this beyond the student population. You're a professor of global health at Duke University in Durham, North Carolina. I'm interested in your views on the wider American population, and again, so that we can, here in the UK, look at what's happened there, learn from the good and bad bits of what has played out in America. So how respectful in general has the American citizenship, the American population been around social distancing and the wearing of face coverings, for example? Have the Americans embraced it?
Yeah, it's a good question. I mean, one of the problems, of course, has been that the Trump administration has mounted arguably the worst public health response in the world, right? He denied that there was a problem. In his
own words, he deliberately played it down.
Deliberately played it down. We now know that, actually, from recent reporting. As you know, he deliberately played it down. He has interfered with the work of all the public health agencies, the CDC, the FDA, Health and Human Services. He refused to wear a mask himself, sending a signal to his supporters that wearing a mask was a sign of weakness. And there's some really fascinating research that has shown that in states that had Republican governors or very large proportions of Trump voters, mask use was much lower. So we know that people were more likely to die from not wearing masks and not adopting social distancing in places, that were taking their cue from Trump or Republican governors. And of course, Trump encouraged people to break social distancing. He literally asked his supporters, to march to Democratic governors' state houses to demand that states reopen. He has wanted people to stop social distancing. He has wanted, of course, the CDC to stop testing, and they granted him his wish. One of the great tragedies, and there are so many, one of the great tragedies of America's response to COVID-19 has been the way in which the leadership of public health agencies have essentially become his marketing arms. When Trump has asked them to jump, they've said, sure, how high? And the CDC shockingly agreed to drop their recommendation that people without symptoms should not get tested. You are never going to get on top of this virus unless you test people without symptoms.
But what about now?
Don't have symptoms.
What's it like across America present day, now that people have seen the infection rate, the mortality rate? What's it like now? What's life like in America now in the streets?
It's a patchwork, right? It's a patchwork. Some states are doing well. Some states are doing really badly. We've got some states where the virus is on the rise. I live in North Carolina. We are still having around 1,500 new cases per day. We have a population of about 10 million people. And I would say where I live, which is a heavily democratic city, Durham, very progressive, mask use is high, social distancing, there's a high awareness of social distancing. If you go to other large states, the adherence to social distancing and to mask use is much less. And, again, particularly states with Republican governors, states like Alabama and Texas, we know that the Northeast is doing quite well. New York, of course, is doing well as well, and that's because of aggressive public health measures, high mask use, better contact tracing. We don't really have much of a contact tracing system here in the US. There's probably only 5 or 6 states, according to the best research that we have, that have enough people doing contact tracing. And if you're not contact tracing, you're not going to be able to get on top of this virus until we get a vaccine, or until we've got a scenario, not a mythical scenario, by the way, a scenario in which perhaps everybody could get tested every day from a simple spit test. Then we are going to continue to have these sorts of second and third waves, as you're starting to see in the UK.
I'm also interested in, Gavin, I travel back and forward to America, usually did, 4, 5, 6 times a year. I love your country. I'm interested also in how the fabric of it has changed, because America, of course, relies heavily on tourism as part of its economy.
Sure.
My goodness, you mentioned New York now. I cannot imagine what New York literally must even look like with such a depletion in its tourist numbers. The likes of Las Vegas, for example, tourist mecca, for goodness sake, isn't it? In terms of tourist heartland. What do these places actually look like, and what's the atmosphere like in these places, which life is tourism?
Yeah, I mean, tourism is obviously hugely down. I mean, the city where I live in actually is quite a tourist hotspot. We normally have 10 million visitors a year. This year we've got a prediction of 4 to 5 million. So I think that seems to be about the norm, that tourism is, cut in half. In some cities it's probably even more. The response to that surely has got to be public intervention and government intervention, right? And here again, not only has the United States government, the federal government, failed on controlling the coronavirus, it's also really failed on providing the sort of economic relief that you would want to see. You really would want to see relief, right, for hotels and restaurants and bars. I'm very, very sympathetic, obviously, to the pain that restaurant owners and pub owners feel when the government is asking them, to cut their numbers or to shut completely in some places that are having awful outbreaks. That has to therefore be accompanied with economic relief. I think that really it's the double whammy that's needed. You've got to control the virus, and to do that, sometimes it does mean curtailing the economic activity. You also, at the same time, got to provide economic relief. And again, the federal government has been pretty paltry and not very generous on that front, and it's being left often down to individual states or individual cities to provide that kind of relief.
Let's see if we get a vaccine anytime soon. I know part of I saw that part of one of Trump's spokespeople basically optimistic that we may get a vaccine, and guess when? Just before the election. I don't know if that's going to happen or not, Gavin.
No, I mean, look, what's extremely worrying to me, first of all, you may know that the operation here to develop an American vaccine is called Operation Warp Speed. I think that was a very big mistake calling it Warp Speed, because you don't want this to be rushed. You don't want to roll out an unsafe vaccine. We know that Trump is behind in the polls. He's losing right now. He has placed much of his bets on a vaccine that he wants to announce in October, the so-called October surprise that's going to win him this election. And the writing's on the wall. He has said that. We know that his FDA commissioner, that the head of the Food and Drug Administration, that regulates drugs, has said that he would be willing to do that. And we had a warm-up for it. On the night before the Republican National Convention, the head of the FDA and Trump had this ghastly press conference where they authorized the use of convalescent plasma, plasma that's been taken from people who have recovered from COVID-19. There's no good data on this. The FDA commissioner misrepresented the data to make it sound like it was a bit of a miracle. And we now know from reporting in the last few days that, again, Trump put pressure on the FDA to do that. So I am very worried. It's a very, very real possibility that the United States is going to rush out a poorly tested vaccine that hasn't gone through all of the trials, particularly these large phase 3 trials. And if that happens, honestly, that could set us back enormously. I will go to my grave as a passionate believer in the power of vaccines. Vaccines have saved millions of lives. I would not take an Operation Warp Speed vaccine that hasn't been tested properly, because I don't think it would be safe.
Gavin, thank you very much indeed. Gavin Yamey, Professor of Global Health at the Duke University in Durham, North Carolina.